our last health nugget, we looked at who is at risk for developing diabetes, signs to look for that indicate that you might have diabetes, and problems that develop in those who have diabetes. And in today's health nugget, we are going to look at how diabetes is diagnosed and how it's typically treated. There are three basic tests that are done to diagnose diabetes. One is a fasting glucose test where you have your blood drawn and after not eating for at least 8 to 12 hours. Your blood sugar level should be below 90 milligrams per deciliter if you're really normal. Some organizations say below 110 or below 100, but we find that if your fasting blood sugar levels are that high, you're already on the pathway to diabetes. If your fasting glucose is between 90 to 125, then you're pre-diabetic. Again, other organizations use 100 or 110 as that lower cutoff for pre-diabetes. But again, we see that these cutoffs are too lax and don't reflect the actual risk for developing diabetes. And finally, if your fasting blood sugar levels are 125 or above 125, actually you are diabetic. Another test is called hemoglobin A1C. It measures one of the protein molecules that helps carry oxygen in your red blood cells. As these proteins float around in the blood, they last in the bloodstream for about 3 months, they become progressively coated with sugar, and the test measures how thick the sugar coating is on those molecules. The higher your blood sugar is on average, the thicker that coating will be. If your hemoglobin A1C is 5.6 or below, it's normal. If it's 5.7 to 6.4, well, you got prediabetes. And if it's 6.5 or above, you have diabetes. Finally, you can do an oral glucose tolerance test. For this test, you're given 75 grams of glucose to drink after fasting for at least 8 to 12 hours, and your blood sugars are tested 2 hours after taking the glucose. If your blood sugar is below 140 milligrams per deciliter, you're normal. If it's 140 to 199, you're pre-diabetic, and if it's 200 or above, then you have diabetes. How is diabetes usually treated? Well, as you know, it's treated with medication. Studies show that when you are treating diabetes with medication up until a certain point, the better your blood sugar control, the fewer complications you develop from that diabetes. But once your blood sugar control gets closer to normal, hemoglobin A1C levels getting below 7 to 6.5, the risk of dying increases. This is because medication can cause your blood sugar levels to go too low, and you can die from hypoglycemia or low blood sugar levels. But when you don't use medication and you use natural remedies, including changing your diet, exercising, losing weight, and a number of other healthy modalities, you don't have the risk of life-threatening hypoglycemia. You can get the blood sugar levels all the way down into the normal range without the risk of death. And when your blood sugar levels are back into the normal range, the complications of diabetes can halt or reverse. This is the only way to actually reverse your diabetes. How can you reverse your diabetes? Well, keep an eye out for our next health nuggets as we will explore together the steps that you can take to reverse your diabetes.